theme of today's webinar is about bringing a focus to the impact and the opportunities that peer support can bring. And peer support has been getting much more recognition recently with strategies like the Creating Hope Together and Mental Health and Wellbeing Delivery Plan, making really clear commitments to embed peer support within mental health services and in communities. And this reflects what many of us already know about peer support and its power to change lives, and also the difference it can make for individuals, communities, and services. But at the same time, we know there's still more opportunity out there for peer support. And to really embed peer support across Scotland, we need to be able to show its impact. We need to be able to talk about it in ways that others can connect with. And we need to keep sharing examples of what's possible. And that's really what today's webinar is all about. And over the next hour, we'll take a look at some of the latest evidence and research and hear examples from people and organisations putting peer support into practice. So we're really fortunate today to be joined by a panel of excellent speakers. We have Ruth Stevenson from Ruthless Research, who will present key findings from the Big Scottish Peer Support Survey. We have Holly Hendry from the Scottish Recovery Network, who will be sharing details of our upcoming insight reports. And we'll then hear from Kelly Gilmore from Mindspace in Perth, who will outline the difference that peer support has made for Mindspace, the community, and the people who use the service. And finally, Sue Lyons from the Discovery College will share how they've created a shared local understanding of peer support and established a peer network. So, without further ado, we have a lot to cover in this hour. So I'm now going to pass you over to our first speaker, Ruth Stevenson. Over to you, Ruth. Thank you.
Thanks very much. Hi, everybody. I'm Ruth Stevenson. I'm a freelance researcher based in Edinburgh, and I'm going to tell you a bit about the Big Scottish Peer Support Survey. So it's a survey that Scottish Recovery Network commissioned last year to find out what's happening in peer support in Scotland at the moment and to gather evidence so that they can have a really good understanding of the state of peer support currently and think about how best to understand and support peer support in Scotland going forward. So just share my screen to find my slides. There we go. Am I up? Is that right? Yeah, great. Okay, so first of all, I'll just tell you a little bit about what we did before I give you some of the key themes that came out of it. This was a web survey that we undertook. And it was a web survey completed by peer support groups, services and activities in Scotland. We defined peer support groups, services and activities in Scotland in this way so that we made sure we got the right people to fill the survey in. We wanted to hear from groups, services or activities that hosted either one-to-one or group peer support according to a definition that we'd put up there. It was important that the primary focus of the peer support was mental health and wellbeing. And it was important that at least some of this peer support was delivered in Scotland. So if you were a service that met that definition, you could fill in our survey. We cascaded this survey out as widely as we could. Primarily, we started off through the Scottish Recovery Network e-news, some other targeted emails. We had it out on social media, and we asked people to share it with whoever they thought it might be relevant to. It was quite a long one. It took about 15 minutes to complete it. So you can imagine we gathered quite a lot of information, but it was a big commitment for people. So we're really hugely grateful to anyone that was generous to give us their time to fill that in. And it was open around this time last year, August to October last year. And we were delighted to say that 105 services completed the survey. So that's a really good sample to gather evidence from. So what to tell you about peer support in Scotland at the moment. This is a map that shows the distribution of the peer support services across Scotland. Now, this is just based on the headquarters of the peer support services, so just where their main base is. But you're probably not surprised to see that there's a big cluster of services across the central belt and in the main cities, but some in other places too. Um, so yeah, we found that there was peer support headquarters in 28 of the 32 local authority areas, but actual peer support was being delivered across all of the 32 local authority areas. So it's pretty widespread across Scotland. We asked what kind of activities these services were doing, and there was all sorts. In fact, we found that the different services were doing multiple kinds of activities. So it didn't tend to be that it was just sort of one thing they were doing all sorts. So more than two-thirds were doing in-person support groups facilitated by peers, but then more than half were also doing one-to-one support groups provided by peers, and around half had paid peer workers in mental health services. Then beyond that, we had about a third that were doing more informal peer-led support, about a third doing online support groups, and 27% now doing text-based support, so things like WhatsApp or email or something like that. So absolutely wide range of stuff that people were doing. I'm going to tell you some of the key themes that came out of it now. And as I say, this is a 15-minute survey, so there's all sorts I could tell you, but I'm going to pick out the main things that we thought were really key and vital. And the first one was there's an absolutely clear demand for peer support across Scotland at the moment. In our survey, we found that more than 18,000 individual participants benefited from peer support in the previous year. And as I say, this was happening across all 32 local authority areas of Scotland. We also found that more than half of the services were delivering remotely or online as well as that. So it's not just that it's happening in person right across Scotland, there's that remote opportunity to take part in it as well. And to further demonstrate that there's a clear demand, we found that more than a quarter of services were facing a challenge that they couldn't even meet the high demand for peer support that was coming to them. Something else to tell you, another key theme coming through is that most of the peer worker roles are in the third sector. I mean, by some huge margin. So third sector peer worker roles are the ones in blue there. 87% of all the peer roles across Scotland are in the third sector, with only just a little sliver there in the public sector or another sector. So it's absolutely at the moment a third sector thing that's happening. Here's the different sources of funding as well, where peer support services are being funded from. We are again finding that funding is coming from multiple sources for each of the different services. So about a third getting funding from charity or voluntary sector organisations, 3 in 10 from the Scottish Government, 3 in 10 from trusts and foundations, 3 in 10 from health and social care partnerships, and about a quarter from donations from individuals. So it's funded from all kinds of different sources, including at the same organisations. In terms of resourcing and who's actually delivering the peer support, we found that there was more than 1,000 unpaid peer workers in Scotland last year, but only 235 peer workers that were actually being paid for their services as a peer worker. So by a long way, this was last year more of a thing that was being done on a voluntary basis rather than a paid basis. That's just a little thing to demonstrate that visually. So 83% of the peer roles were unpaid last year. We also found there was relatively few managerial roles for peer workers. Only 6% of the peer workers in total across Scotland were managers last year. On the plus side, however, most of the peer services were at least partially peer-led. So there's about a third there that were fully peer-led and about and half there that were partially peer-led. only 9% not peer-led at all. So that seems to be a positive thing that so many have got peer leadership within the services, although around 1 in 10 not having any peer leadership at all is perhaps something to think about. We found that the vast majority of the services do provide some sort of support and supervision for their peer workers. So that's good to make sure that they're supported in their role. But again, almost 1 in 10 are not providing any support or supervision for their workers, which is something to think about. Similarly, the vast majority are providing training and development opportunities for their peer workers, but 16% who are not providing anything like that is again something to consider. One of the key things that we found coming out of this survey was the huge difference in types of peer services that there are happening in Scotland at the moment. And one thing to tell you is that some of the peer services are very, very small, very, very informal services. The smallest service that we found in our survey had only 3 beneficiaries in the last year, so a really, really tiny one. We also found that 28% of all the services were only operated by unpaid peer workers, so no paid ones in there. We found that 29% were independent, so nothing to do with any wider organisation. 13% not formally constituted, so yeah, really informal groups. 8% operating with no sources of funding at all. And the key challenge that we found for these kind of smaller organisations was 17% facing the challenge of feeling isolated from other peer support services, being on their own out there doing this. But on the other hand, some of the peer support services were absolutely huge. The largest service that we recorded had 3,000 beneficiaries in the past year. So that's a big difference between the smallest and the biggest one. And we found that 29% were being operated by only paid peer workers, so they didn't have any volunteers at all. And 71% were affiliated with some sort of wider organisation, so maybe a charity or public sector body. The kind of challenges that these bigger organisations were facing were quite different. They tended to be concerned with keeping consistent management of peer workers and safeguarding their peer workers. And they had this kind of perceived tension going on, being concerned about whether if they were making their peer support more formal, does that mean that they're not really being able to have bespoke local solutions because they've got sort of Scotland-wide formal kind of approaches that they're being imposing onto the way that things are done across their service. And they also, along the same lines, had this sort of tension in their heads, thinking, well, if we make it more sort of professional, as I say in inverted commas, does that mean that it sort of dilutes the ethos of what peer work is all about? So, see, some of these were the tensions within the bigger organisations. We did ask what kind of challenges the peer services were facing, and here are some of the main ones that were faced by peer services last year. These are the ones faced by more than 1 in 5 of all the services, so the ones that were quite prominent. I'm sure you're not surprised to know that the top one was having a low budget, but other challenges were lack of understanding amongst decision makers, unpredictable or sporadic attendance from the beneficiaries, meeting high demand for support. That's the one that I've mentioned already there. There's also recruiting and retaining peer volunteers and fundraising, and also a lack of understanding amongst potential participants. So, yeah, there's a sort of communications issue there amongst decision makers and potential participants of just getting the message out about what this thing is all about after all. But what I would tell you is that the peer workforce was so passionate and so enthusiastic about what they were doing. These services really just cared so much about peer support and peer work in Scotland. Here's a couple of verbatim quotes that we had from people. I feel very privileged to be able to offer the opportunity for peer support to work its magic. And someone else said, peer support in Scotland is hard work, but it's also so valuable and amazing. People working in this area are so passionate and motivated. And that's only two quotes from many, many that I could have picked out to demonstrate that. But the other thing coming through really strongly was the worry that peer support was perhaps not fully valued for the impact that it was having. Here's some things that people said to us. I have concerns that peer support is not valued by some funders. And someone else said peer support is a valuable commodity that I don't think is taken seriously enough. And someone else said the value of the work is not widely recognised. So that's a concern that I would leave you with from my whistle stop tour of this peer support survey that we did last year. That there's a lot of people doing really, really good, valuable work out there. But is the message out there that enables that to be as valued as it could be for the impact that's happening? And I'll leave it with you there.
Thanks so much, Ruth, for sharing that. And yeah, I'm going to pick up off the back of Ruth now, and I'm just going to share my screen. Um, so thanks so much, Ruth, and thanks so much for your support throughout this work with us. And I'm going to build on kind of what Ruth shared, and you might and chat through like over the next 2 minutes, 2 minutes, not quite 10 minutes, over the next 10 minutes, chat through a bit of kind of impact and opportunity. And you might be wondering what we're kind of doing with this data. So the data from the Big Peer Support Survey, and along with other data sources, sort of Scotland-wide and internationally, and the learning and experience through our work with people, services, organisations in Scotland who are planning, delivering and participating in peer support. I say we, Louise, our director, has been working really hard to produce a series of insight reports. And these insight reports have kind of four key themes, which are peer support in Scotland, peer support in early intervention and prevention, peer support in crisis and distress, and peer support enablers and barriers. These insight reports will be launched sort of end of the year, beginning of next year, and really aim to increase knowledge and understanding of the current and potential role of peer support in mental health. They bring a lot of what we know into one place and actually provide a really helpful springboard for those who are planning, delivering peer support strategy, services and activities. So I'm just going to start with kind of leaning into the policy landscape as Ailey kind of touched on when we started the webinar, and just some of the cross-cutting themes that are coming out of this. So if we look, at Scottish Recovery Network, we'd say it's a really exciting time for peer support. And I think what you can probably read from what Ruth shared is that there is opportunity to be able to grow and build the landscape, the peer landscape in Scotland. There is opportunity around that, and we can see that from what's come out of the Big Peer Support Survey too. And in terms of like the wider policy context, if we look at Scottish Government and COSLA's mental health and wellbeing strategy, the Creating Hope Together suicide prevention strategy, population health framework, and also the recently published health and social care service renewal framework, there are some cross-cutting themes that are very relevant to our conversation today. And a couple of those are a sort of recognition and a recommended need for a shift in the way we do things that focus on whole system, cross-sector, collaborative approaches, and that the knowledge, skills and experiences of people with lived experience are harnessed, and this includes peer support roles and lived experience leadership. And so this tells us that there's opportunity within the current landscape. What we know from the evidence is one, that peer support works, two, that peer support can play a significant role in improving people's access to, experience of, and positive outcomes of mental health services and support, and really providing accessible, flexible, adaptable support when people need it. And this is kind of twofold, because the other thing that we know is that developing peer support is a way to transform culture and practice in mental health services in embracing an approach that's focused on whole person, is trauma responsive, human rights based, and supports recovery. I'm going to sort of touch on, and I know Ruth did sort of lean into this a wee bit in her presentation, but we know that peer support and peer worker roles do sit across our mental health system within community and NHS settings, more so within community settings in Scotland. And peer support services and roles look like lots of different things. And Insight Report 1 really unpicks this in some more detail, but I thought I'd just touch on it now. So some examples of what these kind of services and roles um, look like are peer support groups, whether online, in person, or using other kind of digital means. One-to-one support for people experiencing distress and crisis, for those seeking help to manage their mental health and well-being, and for those seeking support to continue their recovery journeys. And this kind of really illustrates the different stages where people might be at and the role of peer support within this. Peer roles as kind of listeners, navigators, and communities in community settings, supporting people to connect up with activities. Oops, I've gone off the slide. Connect up with opportunities and activities locally. Peer-led recovery education and self-management. And one kind of approach that is sort of driving this a bit is the recovery college model. And then some roles that there are a little bit of, but maybe not so much in Scotland, are peer-led learning and development roles, peer co-production and engagement, and lived experience kind of management and leadership roles. And I'll talk a wee bit more about that in a bit. In terms of opportunity, and really like from the evidence that we have, both kind of local and international, embracing lived experience and peer, there is opportunity embracing lived experience and peer approaches across leadership, service design, and service delivery. And this helps us to challenge the status quo. And we know that this is not meeting the needs of people right now. And I think this really goes back to my earlier point around peer support as a way to transform culture and practice. And this is the transformation that's needed to challenge the status quo that's not working for people right now. We also know that peer developments in many ways have been bottom up in Scotland, and bottom up being the local people coming together in communities or services sort of responding to locally identified needs. And while there's pockets of incredible work happening, when we look at the national picture and take a bit of a bird's eye view, there's limited, so this has resulted in limited, not non-existent, but limited development of recovery approaches and peer working in NHS mental health services. So in terms of opportunity, what we don't have is sort of national strategy or direction to grow and sustain recovery approaches and a peer workforce nationally. And this is where Scotland probably lags behind other countries that have more of this focus. Because we know, and as I kind of shared before, that developing a peer workforce can be part of a coherent strategy for culture change to embed recovery and lived experience in the mental health system. So there is real opportunity for that commitment and what it would bring the peer landscape in Scotland. I'm going to just share some enablers, and within Insight Report 4, that's the focus of that report, and we'll really delve into this in more detail. And this was unintentional, the theme of the S, each statement beginning with an S. So that wasn't intentional until I noticed it on the screen. So the ones that I'm going to share with you are, to enable this landscape to grow in a way that really values, Ruth was talking about maybe some, some thoughts around the value of peer support not being recognised at a strategic level. We do need strategic commitment and a commitment to recovery and peer support strategy and delivery. It's really important that we look at developing a shared understanding of peer support, and this really sets a strong foundation. And this is about how we articulate and define what peer support is and the difference it's making. Strong peer leadership, and this is sitting across the level, so from government and at a local level, and a solid infrastructure. And so in thinking about an infrastructure, we're thinking about everything from team readiness, recruitment, support, training and development roles, impact and evaluation. And you can probably see that none of these points sit in isolation, that they all kind of support one another. Scottish Recovery Network are working hard in this space, along with many of you who are in this Zoom call, like on the Zoom call today, and with others in our network. And I just wanted to share a few things that we're kind of doing around this stuff. And so we're currently co-designing a framework for peer support that will help guide peer support values development and practice. Through our Creating Hope with Peer Support project, we're working with our networks to build capacity in community-based peer support and suicide prevention. You're here today as part of a webinar that sits in our Peer Connects programme. So we're really committed to bringing people together to share learning, insight from things that are happening locally and across the world. And yeah, giving people an opportunity to connect and share learning. And we're working with partners to reshape the current peer-to-peer training and development resource. So there's lots happening, and Scottish Recovery Network isn't doing any of this alone, and that would be impossible. We couldn't do any of it alone, and we're so grateful for the experience and learning of many of you today and those who are really driving forward a commitment to peer support. So that has been, in a nutshell, a bit of kind of impact and opportunity. And what's going to happen next is that Kelly and Sue are going to kind of bring this to life with some real life learning and experience. So I'm going to pass over to Kelly. I'm going to actually stop sharing my screen. So I'm going to pass over to Kelly, who's from Mindspace. She'll introduce herself and chat through what's happening there and the impact of peer support for the work they're doing in Perth. So over to you, Kelly. Thank you.
Hi everyone, thank you so much from Scottish Recovery Network for inviting me along today. It's a huge privilege to be part of the wider network of what we all trying and so passionate to do. So I'm the peer support development worker here at Mindspace in Perth. We're a very small organisation, so actually I wear various hats within the organisation. Can be challenging at times, however, coming into the organisation on my own journey, my own discovery of who I was, and from needing some support, the opportunities from walking in the door to where I am now, if it wasn't for being introduced to Mindspace, I don't know where I'd be. So I'm very, very privileged for the whole peer support model of work and giving, having choice. So I've been here at Mindspace now for just over 10 years. I support and coordinate a small team of peer support workers. We're all fully trained to PDA level, SQA. We provide support to Perth and Kinross residents. Some of the rural areas as well. Peer support, I think it's wonderful, the past two people chatting. It's so nice to just hear what's going on and the challenges, because I think the key themes are, they're the same, the things that we're all experiencing. So the opportunities that peer support can bring, I think one of the slides that Ruth had said were magical. I wouldn't be here if I didn't get the opportunity to work with peer support. So peer support can bring so many things to our own lives, our community lives, and the whole organisation. So just being here today as part of a bigger network, it's making sure that Perth are included and trying to dip in and out of the bigger focus and what we're all trying to do collectively. And I think we're always stronger together as a bigger organisation of everyone's success as well, the successes and the wins, alongside the challenges, embracing those moments and seeing how we could work better together. So as you were saying, we're part of the framework, we're part of the evaluation, we're just trying to be part at Mindspace of all the little nooks and crannies that we can be to be part of that bigger picture. But we're very, very privileged to be delivering peer support here in Mindspace. So the things that we can really support people to do are absolutely endless. Life-changing, the beginning of a discovery of who we are. So again, it's quite nice to be able to say that we're part of a team here at Mindspace who do provide support and supervision to our staff as well, which is quite nice, because I hear that doesn't always happen. Looking at any people out there that deliver that a lot as well, I think it's great to share experiences and ways of working. Always up for that discussion. We're also within our community. We do a lot of peer support in the community. People are not always very comfortable within an office, a building setting. So we're really peer-led as to what matters to the person. We'll follow that lead. Obviously, we've all got boundaries and things in there and safeguarding. We've also got a few partnerships on the go. We're working with Perth College, which provides the students of Perth with a half a day of peer support. So there are lots of little partnerships that can be going. It's really hard because sometimes it's a chicken and egg situation. It's like, how do you grow the capacity within some of the barriers that we're all experiencing? So again, organisationally, putting Mindspace on the map of peer support is so important to us. And if you think, how has it benefited peers? Well, the choice, having a little bit of choice and not an experience of a relationship, of being asked what matters to you instead of a slight directorship. And I'm not dissing that at all. We need a bit of a balance there. But it's not often that people get choice in this model of recovery. So we're really, really focusing on making sure people do have can make informed choices. So when actually someone is heard, believed in, validated, understood, with all of those peer values, the skills, the principles, the way in which we all work as peer support workers, no wonder there's a real good positive outcome from that. And it could lead to many, many lifelong challenges. And I think that role modelling is a massive part as well of the peer relationship. So the essence that we can all sort of say, you're not alone, we can actually really live and breathe all of that stuff. The community, the hope is that we'll have a healthier, happier community with a much, much wider spread of the model of peer support, because it can be so life-changing. Peers can, with each other's support, there's so many things that you can be achieving. It depends on the person. It could be learning, working on strategies. It's sharing coping mechanisms. Again, there is a demand here. The demand is it's hard to cope with, because you don't want people waiting for peer support. You really want to capture people in the moment. So again, we're trying to develop things to accommodate that within our offer. And we've got a small drop-in group just started last month. So we could only offer it once a month, but again, we're so focused on trying to support people, because often what happens is people want to give back, and we could really nurture that, and we can do co-production. We're really, really up for the bigger picture. And the hope is really, from a Mindspace perspective, is that we can accommodate people. We could support people to live more, meaning and purpose and happier, healthier times of life. It's not without its challenges, as we've all experienced, but really want to advocate the fact that, if it wasn't for peer support, I'd probably still be at home, not feeling terribly well. So huge advocate, role model, and the belief that I can share from that true experience, that actually I've worked from coming in as just going into service to look after myself, working way up, volunteering, part-time working, all funding related, of course, along the way, and took on the peer leadership, peer support development worker role full time. So to be able to live and breathe, if I can do that, supported and nurtured, of course, then anything is possible. And I think it's interesting, some of the dialogue that's been in the language that's been talked about today. I think it's that is the hardest part. It's trying to explain and express the possibilities of peer support and actually what it is. Because some people just see the one, I need help, I want fixed. So the honesty, the transparency of going in, okay, we might have to step back a little bit here. It's a little bit more along the lines of X, Y, and Z. And I think, again, that really supports that trust in relationships. It's almost like a fast bond. So I am waffling a little bit. I'm so sorry. Is there anything I've missed in particular to the hopes of the conversation today?
That was great, Kelly. And I was actually scribbling down some notes there. Thank you so much. And thanks so much for sharing a bit of you and your journey. And it's an important part of the story. So thanks for sharing that. And I noted down something that you said that was like, when people feel heard, believed in, and valued, this leads to positive outcomes. And I thought that was really powerful. Yeah.
Thank you. That's the biggest part, was belief for me. I didn't have the belief. Yeah. And actually, when the staff here believed in me, then that meant so much. I don't know why. I can't pinpoint it. I don't know why. I just didn't feel that I had skills and, all these kind of things. But with that nurture and that support that I needed in that moment, it was there. And that's why I think I really don't want waiting lists.
Yeah,
I mean, we
could have another webinar on that. So thank you so much. I really appreciate it, and thanks so much for just giving us that bit of insight around Mindspace and all the things like the role of collaboration and how you balance kind of growing, responding to people's kind of the local needs and balancing that as a small organization. Some thoughts around that. So thank you. We're gonna pass on to Sue now. So Sue, are you here? I know there's been all sorts of connection issues. Sue, you're here. Hello. I feel like big virtual hugs needed. So you're here. I'm going to pass over to Sue, who is the Discovery College Manager in Highlands, to pick us up from here. Thank you, Sue.
Well, it's today's been a microcosm of what working in the Discovery College is like, because it's been chaotic this morning. For those of you that don't know, the Discovery College is a recovery college model based in Highland. We cover the whole of Highlands. We have 2 centres, where one of which is in the Eastgate Shopping Centre in Inverness. It's an old Argos unit. It's up by next, so if you're in Inverness, pop in and see us. But that means that when there is an evacuation in the shopping centre, we have to evacuate. So this morning we had an evacuation and a power cut. And so I'm not on my laptop. I did have a sort of mini PowerPoint presentation, but I'm a bit meh about them. So it was only a couple of pictures, really. And so I'm here. I feel dishevelled and ill-prepared. So I'm very sorry. What I'm going to do today is talk to you a little bit about the development of the Recovery College model here in Highland and what we are trying to do with that, and also how we are trying to drive excellence and support within peer support right across Highland and affect system change. That sounds like a lot, doesn't it? It is a lot. It's mad, but there you go. So I've been involved with the idea of a recovery college model service in Highland for over 10 years. My background at that time was as an advocate, working for a collective advocacy organisation, a membership-led organisation, and our members had asked for and campaigned for peer support services and a recovery college model for a long time, even before I came along. I was at the Refocus on Recovery conference in Nottingham a couple of weeks ago. I don't know how long ago it was. It feels like yesterday, but then it feels like last year. And Lisa Archibald talked about the roots of recovery and peer support being in activism. And that is what started this process here. Our members were activists. They put pressure on for the development of a recovery college model in Highland. So NHS Highland took that idea and said, oh yeah, we're quite interested in this in theory, and stuck it on their strategic plan and never did anything with it. So about just after COVID, Centred, which is a charity which up until then had delivered commission services, support services for people living with mental illness in Highland, were we'd be quite interested in exploring this. And so they and I got together and we came up with a sort of outline of what our members wanted, what Centred felt their supported people wanted. And we brought that together and presented that to NHS Highland, and they were broadly supportive, but didn't have any money and didn't really have any resources, any capacity to deliver it. So we just went ahead and did it. Initially, it was myself and a colleague from Spirit Advocacy who worked with Centred to deliver peer support training using the peer-to-peer resource to 10 people. And the intention was that they would form the foundation of peer support and the recovery college. And that's what happened. We still have 5 of those peer supporters in different roles involved in the recovery college here. I then left and went on to do something else. And about 18 months ago now, they advertised a vacancy for the manager of the Discovery College, as it was then called. And I applied and got it. So that's how I came back. It's called the Discovery College because, like Kelly talked about, it's a discovery. It's a void of discovery for the people that come in here, but also for our peer support workers and also for me. So we are now across 2 sites. We employ, I had to count them up, 1, 2, 3, 6, 7, 8, 9, 10, 11 peer support workers and me. It is a wholly peer-led service. I have lived experience. Our chief executive shares his lived experience. I work as a peer support worker. We have people paid in relief roles and in paid part-time roles and in full-time roles. We have also 4 volunteers who support us and also do peer support work and also stock the cups up and make sure there's enough coffee for everybody and all that sort of stuff. Fundamentally important to what we do is the drop-in, and a bit like Kelly talked about, that we don't want anybody waiting for peer support. So we operate 4 days a week in Inverness, where we have a drop-in from 10 till 4, and people can just come along. They can get a coffee, they can chat to a peer support worker, they can colour in, they can sit quietly in a corner and read a book, they can do a jigsaw, they can play chess, they can play music, whatever they need from that space. We call it our Discovery College Lounge, and that's exactly what it is. We provide teas and coffees and snacks, and sometimes people bring in baking, and sometimes it's challenging and sometimes it's light-hearted and fun. It can be everything in one day. In addition to that, the last 12 months, we opened here in October 2024, 3 days a week, and we increased to 4 days a week after Christmas. In addition to the drop-in, we also run a variety of sessions. Most of those sessions over the last 12 months have been around connecting people with us, connecting people with each other, connecting people with themselves. Some people, like we've heard already, don't really know what their own recovery feels like, what we have connection, hope, and belonging painted on the wall in our Discovery College line, and some people don't have any of that, and that's what we've tried to do this last 12 months. We are now seeing in Wick, what we're doing, we opened a centre in Wick a fortnight ago. So that's, we are 2 days a week in Wick, Tuesdays and Thursdays, 10 till 2. We also run 2 sessions in Castletown as part of another collaborative project where we run sessions on Monday and Wednesday. And we also run online sessions. But most of the work that we've done has been around connecting people. What we're looking at how we move forward is how we develop our offer to be to focus on wellness, to focus on knowledge and education, and that's something that we're looking going forward. I think for us, what we find here are some of the challenges that were spoken about in the bit of the first presentation that I missed a bit of, I'm sorry. But that in Highland, peer support is not taken seriously. It is not seen as a reliable resource, and we are fighting really hard to change that. NHS Highland have lots of people who are supportive of peer support as individuals, but actually getting that system change to see peer support as another option, as something that people can use as a valued resource, is proving challenging. We are seeing across the 2 sites over 100 people a week. And, we've seen in both presentations people talking about the capacity and how the demand is such that it's running away from us. It frightens, it keeps me awake at night. How are we outstripping the funding that we've got? We've been really fortunate with funding. We've got lottery funding. We have got a big pot of funding from the NHS, but actually how we keep hold of it all whilst it's all running away with us is really challenging. It's worse for me as well because I say yes to everything. It's a character flaw. So if somebody says, so do you think we could run a session at this animal farm in Leicester? I'm like, yeah, why not? Animals are really good for people's mental health and well-being. Why don't we see if we can do that? So now we're running sessions at the animal farm in Leicester during. So it is a bit of a character flaw. I'm really, really lucky that our chief exec supports that and doesn't mind that about me. He doesn't see it as a failing, really. So it feels vibrant, it feels energetic, and yet we still come up against this barrier. There was some figures in the paper recently that said that people are waiting 4 years for mental health services in Highland. Some people, one person talked about having waited 7 years. That is not unusual. We know that happens. And yet we are still coming up with a feeling from statutory services that peer support is inherently risky and therefore to be avoided. So what we're doing here is we were very fortunate. We've got some money from the Community Mental Health and Wellbeing Fund, and we're developing a framework of peer supporters right across Highland. We are running 3 sessions. We've had our first one, which was about defining peer support. Our next one is in November. It's about strengthening peer support. And our next one is in February, and that'll be about growing peer support. And it's about forcing the system to recognise the value of what peer support brings to the table, to see that we are excellent in what we do. We are experts, professionals. We know what we are doing, and for that to be recognised. We're really lucky to tap into Scottish Recovery Network's national framework. We're part of that conversation as well. And what we're finding is that, like the research that was shown, some peer support offers are single people just running small groups. They're invited. I was quite taken by a bit of research on tattooists that I heard at the conference. So we are sort of reaching out now to some of our tattooists in our remote and rural communities to say, what are you doing? What peer support are you doing? Because actually that's really important to us. What we find is that sometimes in Highland, people are the only peer support worker in an organisation. Sometimes they're paid, sometimes they're not paid, sometimes they're the lady at the shop at Betty Hill that sets up a group because so many people are coming in and telling her how bad they feel. And we're trying to bring all those people together to create a way of talking about peer support for all of us that recognises the value that we all bring and the difference that we can make to people that are waiting 7 years for a mental health appointment. That's it.
Thank you so much, Sue. That was really great to hear examples of what's happening in different pockets of Scotland, and thank you so much for wading through all of your challenges this morning to be here. So thank you, Sue, once again, and thank you to all of our contributors today. And I've just made a note of some sort of key themes just to kind of summarise before we say goodbye. And I think what I heard from these different contributions was that it's so important that we keep sharing what's possible when it comes to peer support. And that we have that shared language and understanding, a collective understanding of peer support and the impact of peer support, the difference that peer support can make, but also that peer support is recognised and valued as a valid resource and approach to recovery. And lastly, we had some conversation in the chat there from Lisa about peer leadership and peer networks. They're so important when it comes to growing peer support. So it's really great to see how it's all connecting in and tying together. And of course, that's part of our role at the Scottish Recovery Network, is supporting those networks to grow and to support the work that you're all doing across Scotland with peer support.